Hello, everyone. I'm Amesha from the Acasus HR team, and this is our monthly podcast session. Today, we are going to hear experienced insights from a very special guest who has a long history of working in public health and immunization. And our topic will be global health trends. Please welcome Dr. Farhana Zareef, public health expert from the Acasus team. Farhana, thank you again for accepting my invitation. I'll be asking many questions about our topic today, but first, I think many of us are curious about your journey leading to Acasus. So let's start with an introduction from you.
Thank you so much, Amisha, for inviting me today. You know, when you asked me about my journey, I found it very interesting because I really haven't looked at it in that context. The amazing thing is, I've always loved children, and after I graduated from med school, pediatric surgery just worked for me because I was helping children get well quickly. I would have loved to continue with pediatric surgery, but there was a personal turning point in my life, and I transitioned to public health. Although I was working in public health, I still continued serving mothers and children to live healthier and more informed lives, though not just in a clinical setting any longer. Reproductive, maternal, neonatal, and child health focused projects with Centers for Global Child Health, Global Fund, United Nations, and USAID organizations were the way forward for me. But this was my professional journey was not limited to this only. Other facets of my professional journey included being a hospital administrator, a researcher, monitoring evaluation, infectious diseases, and immunization expert. These cross-cutting experiences finally led me to Acasus as a public health expert. Now I advise the teams on best practices in immunization, maternal, neonatal, reproductive, and primary health care. And the teams are so talented and versatile that it is really brings me a lot of joy to mentor them, to guide them in the directions to which they aspire to move.
Thank you for sharing, Farhana. What a journey. To begin our topic today, uh, what do you think are some of the current global health challenges that will shape the future of health policy worldwide?
After the pandemic, the most obvious global health concerns deal with communicable and contagious diseases. But global health challenges are not restricted to that only. They also include health systems, mental health, substance abuse, malnutrition, food safety, reproductive health, sexual health, and non communicable diseases as well, with the rise in hypertension, cardiovascular diseases, obesity, and respiratory tract illnesses. All these are have become a whole new challenge for the global health community. Although, when we look at it, the health of human beings is influenced by the global health of not only people, but animals and the environment as well. So, climate change also becomes a big challenge for us in global health. Although, when we talk about global health issues, we could focus on different regions or countries, and every place will have its own set of problems which are peculiar to that area. For instance, some areas in Africa, they suffer mainly from malnutrition, which leads to immunity being compromised, which leads to all kind of infectious diseases. Then there is malaria, then there is measles, which is a vaccine preventable diseases. All these and these issues do not remain confined to their site of origin and affect other people around the world due to the globalization impact. While all these issues, they are global health challenges, but all these issues are overshadowed by contributory factors such as economic and political instability, income and social inequality, lack of education and employment, natural disasters. So all these impact global health in various forms, and at various times.
Thank you, Farhana. As you also mentioned, our work at Acasus is also very closely linked to immunization. And yes, could you please give us a brief background on immunization and its role in mortality?
Immunization plays a huge role in mortality, especially routine immunization of children under 5 years of age. And when we talk about ACAS's role in it, so Acasus works in immunization both in South Asia and in Africa. And our teams have worked wonders with the people on ground and identifying the issues and taking the communities on board and making a way forward. And the gains in those areas have been in Ethiopia, in Pakistan, in Nigeria. They've been amazing. When we talk about immunization, it is always important to remember where we come from. It was 1796, May, when Dr. Edward Jenner first discovered the smallpox vaccine. And after more than 200 years, we still have miles to go as new infectious diseases are emerging and coverage of existing vaccine preventable diseases is still work in progress. We cannot claim a 95% coverage of any of the ongoing vaccine preventable diseases coverage. But the positive thing is that now we have more than 20 life-threatening diseases which are, covered by vaccines. So, and they help people of all ages live longer, healthier lives. Immunization currently prevents 3.5 million to 5 million deaths every year from diseases like diphtheria, tetanus, pertussis, pneumonia, diarrhea, influenza, and measles. And if we only look back over a span of 50 years, we have a lot to feel good about. Vaccination has averted 154 million deaths, including 146 million among children who were younger than 5 years. And of these 146 million, 101 million were infants younger than 1 year. So just imagine the human capital that we have managed to save, the families which have been prevented from losing any of their loved ones, and the productive lifespan that these children, as they grow older, they will have and be a part of their communities and their societies overall. So immunization has in its own way evolved and come a long way, and it's everybody in working in immunization is very committed and very aware of the fact that how important it is to ensure that every child and adult who needs it gets protection for vaccine preventable diseases.
Thank you, Farhana. It's truly amazing how far we have come. And yes, if we take a look at the other side as well, what would you say are some of the current challenges in immunization? How can we improve health systems?
That's a very interesting question because there is always a flip side to the coin. So, you know, beyond pandemic, we had a lot of challenges because the fact is that where we stood in 2019, we still have not regained that lost ground to date. And strengthening immunization beyond pre-pandemic levels, although we worked on it, but a staggering 21 million children remain unvaccinated or under-vaccinated in 2023. Moreover, the number of children who did not receive any vaccines, to whom we often refer to as zero-dose children, reached 14.5 million and increased from 12.8 million in 2019. So these are, awesome figures, like they are eye-opening. And we need, a concerted effort is being made to, at least reach to the level where we were pre-pandemic. Two markers that we use in defining whether, the actual levels of vaccination required to provide herd immunity have been reached or not is one is that the third dose of diphtheria, tetanus, and pertussis vaccine, and the other is that of the measles containing vaccine. And DPT3 is used as a marker of how well countries are providing routine immunization services to children. In 2023, global coverage of its third dose stagnated at 84%, and it has still not reached the pre-pandemic level of 86%. Similarly, the coverage of first dose of measles containing vaccine, it stalled at 83%, with 22.2 million children not receiving the potentially life-saving vaccines. And of course, these figures fall short of the 90% coverage needed to prevent outbreaks, reduce deaths, and achieve elimination goals. So basically, these are the challenges that we are facing. And there have been outbreaks in multiple countries, even in Europe, of measles. And this is the reason why this is happening, that there are so many gaps within the system that we still have to plug, that it's still an effort to, find those gaps and plug them in a timely manner. But having said that, it is, we cannot, for immunization, there is no way that one cap will fit all. All countries are diverse, and there are region specific issues which are complicated by socio-cultural, religious beliefs, and availability of fiscal space with all of the countries. Tailored interventions are required to strengthen the system. And if the systems are strengthened, then that strengthening requires that every country has a comprehensive 5-year plan, which is fully funded. Their vaccinators and managerial staff skills are strengthened. They have to start identifying and finding innovative ways to reach the unvaccinated and undervaccinated children. The vaccine supply chain requires to be strengthened. And, you know, all all these efforts, even if they are in place and the community is not supporting these efforts, then it will all be in vain. So we have to have the community support. We have to generate the buy-in from the communities, and not only social mobilization, but involving the communities, making them a part of this, vaccination effort would go a huge way towards addressing this problem. Another thing which gives us a lot of thought for implementation is that there are a lot of vertical programs and a lot of mini interventions going on all the time, and if immunization or vaccination efforts they coordinate and integrate with other interventions and programs, then we will have a wider scope. For instance, with like the vitamin A and the deworming programs and ITNs, they all used the immunization program as a vehicle for providing this to the community. So in similar way, there are other programs which are running, and which each country will have different programs which the immunization program can associate with and increase their outreach. In today's day and era, data is a very important component. And if our immunization program does not have a registry, it does not have an accurate information system, it is not recording everything electronically so that we can actually assess which areas have, the census shows this number of children there, but we've only reached this number of children. That kind of, real-time analysis of the information coming in will help us identify people who have children who have not been reached, of communities which are being bypassed, and this will help a great good way towards addressing the issue of unreached children. So that is another thing that we all need to think about. But the challenges, they are never ending, and their solutions are never ending too. So we really have to figure out which challenge is the most important for this country to prioritize, and only the locals in that country will decide. So this, for instance, in some countries the cold chain will be an issue, in some countries the socio-cultural beliefs will be an issue. So it has to be tailored according to the needs of that country and their people.
Thank you for sharing, Farhana. Yes, as mentioned, we still have a lot of work to do. How do you think we can tackle these challenges, and what can we look forward to?
We have so much to look forward to. Although vaccines should reach all people who need them when they need them, but increasing routine immunization coverage by reducing missed opportunities for vaccination is a concept that should be applied, across the board. Children and their mothers, they are, you know, they have multiple contacts with the hospitals throughout their life journey. And mothers go to hospitals for their own health. They go with relatives. They go with uh, other issues, and normally the children's are there. So if you know uh, at all points of contacts, whether in hospitals, health centers, clinics, and immunization posts, the vaccines should be available, and the healthcare providers, they at those points should be aware of the fact that any child that comes into this facility or that we come in contact with, we should ask them their immunization history. That will go a long way towards addressing these unreached children. But all these problems that we've been discussing, they have not deterred the new research and technologies from emerging to meet these challenges head on. Um, Recently, the three interventions were jointly articulated by Gavi, BMGF, UNICEF, and PATH. It's known as the Vaccination Innovation Prioritization Strategy, with a clear, aligned perspective on vaccine product priority, innovative techniques, and to communicate across the board all these efforts. The most promising thing that has come up is the acronym is MAP. It's micro array patches, and these are in trial stages for measles and hepatitis. And these are very small patches which are just put on the child's skin, and they have small, projections which just pass into the vaccine into the intradermal space. These do not require a cold chain. These do not require injectables. These do not generate hazardous waste. So it's like, you know, uh, the last mile difficulties that we face with injectable vaccines, which depend on a functional cold chain and trained staff for administration, could easily be bypassed if we succeed in these trials, and then we expand them to other vaccines as well. This is one of the future strategies which is on trial right now. Then there is another strategy to produce heat stable and controlled temperature chain qualified vaccines. Right now, the vaccine chains and their temperature regulation and their cold chain continuation of their cold chain without interruption is essential for the vaccines to be effective. But if we manage to come up with heat stable and controlled temperature chain vaccines, then that would again be a big success. But even with those vaccines, again, the issue will be the even if they are heat stable, then again, trained staff, injectables, and hazardous waste will still remain a problem with those. The third intervention that they are promoting is barcodes on primary packaging, and this is already in practice. And these barcodes are electronically readable, and they make the whole process very safe. And the cold chain, custody, it remains easy. It remains easy to trace the chain of custody for the vaccines. But another thing that has already been used is that compact pre-filled auto-disposable devices. So these, if they are pre-filled and they are auto-disposable, then a lot of the issues that we've been talking about, they've become negated with this. But these are all techniques coming up in the future, and it will be still some time before they could be made available on to the general masses. But these things are there. They are, some of them have already been started using, like I was talking about the barcodes on primary packaging or the compact pre-filled auto disposable devices. These are already in practice. So, and the most promising thing that we look at right now is the microarray patches. So hoping and praying that, the clinical trials, they are already in phase 2, that, they'll move on to a real world implementation soon.
Thank you, Farhana. Once again, it's amazing how far we have come and how far innovation has come. These are definitely things to feel good about, but also to look forward to. Thank you so much for the detailed and clear overview on this topic. As for my last question, I would like to go with the one we ask at the end of every Acasus podcast episode. What is your favorite memory of working with Acasus so far?
I still can't get beyond the fact that, so I was only like, I joined Acasus in August of 2022, and in August 23 there was the global meeting in Dubai. And I was a bit like, I hadn't met anybody, and I was like a bit apprehensive of how the teams and everybody would be. And it was such an amazing experience. All the country teams were present. Everyone was so busy sharing knowledge and experiences, forming connections, and finding best strategies which would align with their local norms. It was such an amazing experience, and I just cannot get over it. The feeling of being a team, of coming together, of everybody being there for everybody. It was totally awesome.
Thank you so much, Farhana. In general, it was so great talking to you today. Thank you so much for sharing your time and all these amazing insights with me. For all of you listening, I hope you found today's session useful and insightful. For more podcasts, visit our Spotify channel under the name of Acasus Podcast. But also, don't forget to follow us on other social media platforms, LinkedIn, Instagram, and Facebook. See you soon. Take care and be safe.